Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, Dr. Thompson. I came in because my legs have been bothering me more than usual, and the numbness is getting worse. It started in my feet years ago, but now it's moving up to my knees. I've lost a lot of sensation in my hands, too.
Good morning, John. It's important that we review these changes thoroughly. Can you tell me more about the progression of these symptoms?
Sure. I first noticed the numbness in my toes back in 1998, and over the years, it just crept up to my lower legs. Recently, I started feeling it in my knees. My hands began to lose feeling about 5 years ago. It's like I'm wearing gloves all the time.
I see. You also mentioned some issues with your right wrist. Could you elaborate on that?
Yes, it swells up a lot, and sometimes it's really painful. My doctor said it's gout and edema. I've been on allopurinol for the gout, and we've adjusted my furosemide for edema recently because of the swelling.
Has there been any improvement with the adjustments?
A little, but it's hard to tell sometimes with the other issues I have going on. The swelling does go down, but it comes back.
And you had a spinal tap recently?
Yeah, that was tough. They tried several times before they got it right. They're looking into what's causing the neuropathy. I'm waiting on those results.
Understood. We'll review those results as soon as they come in. How about your general health otherwise? Any changes in your daily activities due to these symptoms?
Well, because of the numbness and pain, I'm not as active as I used to be. I get tired easily, and I have these periodic fevers and chills. My doctor thinks it might be related to my kidney issues.
Speaking of which, I see here that your kidney function has been a concern. Can you update me on that?
Yes, my kidneys have been a problem for a while. At one point, they said I was at stage 5, but now it's more like stage 4. We're trying to manage it the best we can.
I appreciate your thoroughness, John. Let's go over your most recent lab results and see what our next steps might be. Blood pressure, 138/85 mmHg, creatinine 2.1 milligrams per dl, EGFR 35 millinine 1.73 millisquared, C-reactive protein elevated at 4.8 milligrams per, which could be an indicator of inflammation or infection. Your lab results show your kidney function is stable compared to previous readings, but still requires close monitoring. Your creatinine is elevated, which is consistent with your chronic kidney disease. The C-reactive protein is a bit high, suggesting some inflammation, which might be tied to several of your conditions.
What do we do next, then? I'm really worried about all this, especially with my history of polyps and everything else.
I understand your concerns. Here's what I suggest. First, We need to keep a close eye on your kidney function and adjust your treatment as necessary. I want you to monitor your blood pressure at home and record the readings. We should also consider another nerve conduction study to compare with the last one. Regarding the polyps in your colon, given your family history and the frequent occurrence of polyps, I agree with your previous doctor's advice not to wait too long for the next colonoscopy. Let's plan for that in the next 6 months. For your neuropathy, depending on the results of your spinal tap, we may need to adjust your treatment. It's also essential that we manage your symptoms to maintain your quality of life.
That sounds like a plan. I just hope we can find something to help with the numbness and the pain.
We'll do everything we can. Let's schedule a follow-up in 4 weeks to review your spinal tap results and see how the adjustments in your medications are working. I'll also coordinate with your renal clinic to ensure we're all on the same page.
Thank you, Dr. Thompson. I appreciate you helping me keep track of all this. It's a lot to manage.
You're not alone in this, John. We'll work through it together. See you in a few weeks.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been noticing a lot of changes in my health that are concerning me. The first thing is my weight. I've actually been skipping breakfast to try and prevent gaining more weight, but it doesn't seem to be working. I've been gaining weight regardless, and it's very frustrating.
I see. That must be quite frustrating for you. Have there been any changes in your lifestyle or routines aside from skipping breakfast?
Not really. My routine is pretty much the same, but the weight just keeps coming. And there's another thing that's been worrying me a lot. My stool color changed drastically a few times. It started off black, then turned green, and even topaz before going back to normal. I remember reading somewhere that black could mean bleeding in the gastrointestinal tract.
That's correct. Black stools can sometimes indicate bleeding in the upper gastrointestinal tract. Changes in stool color can be concerning, and it's good that you've noticed and mentioned these changes. What about your sleep and your overall mood lately?
Oh, sleep has been rough. I find myself struggling to fall asleep, and when I do, I can only stay asleep until about 3 in the morning. I've been using Advil PM to help, but it's not ideal. Emotionally, it's been tough too. I've been feeling quite down, lacking interest in things I used to enjoy, and sometimes I even have disturbing thoughts about harming others. It's all quite overwhelming.
It's important that you shared that with me. Thank you. Dealing with sleep disturbances and feelings like these can definitely take a toll on your overall well-being. Regarding your breathing, have there been any changes or worsening symptoms there?
Yes, definitely. My asthma seems to be getting worse. I use my Advair and albuterol inhalers, but especially during the early mornings and when it's hot, my breathing really struggles. It feels like my current medication isn't enough anymore.
Managing worsening asthma symptoms can certainly be challenging, especially when they disrupt your daily life like that. Have you noticed any triggers or patterns that seem to worsen your symptoms?
Mainly the weather changes, and sometimes after I visit my parents. They're both not in the best of health, and caring for them adds a lot of stress, which seems to trigger my mood swings.
That sounds quite demanding. Caring for elderly parents can be stressful, and could indeed contribute to both your respiratory issues and psychological distress. Let's make sure we address all these points today. I'd like to review your medical management comprehensively and perhaps adjust some of your medications. We should also consider therapy for your psychological distress, as it seems to be impacting your quality of life significantly.
I think that would be good. I just want to feel better and manage these issues more effectively.
Understood. Based on everything you've told me, here's what I think we should do. First, I'd recommend a psychiatric evaluation because of your high score on the depression screening. Starting sertraline could help manage your depression symptoms, and arranging regular therapy sessions will provide additional support. For your respiratory issues, we might consider adjusting your asthma medications and possibly adding tiotropium to help manage your symptoms better. Given the variability in your stool, we need to monitor for further episodes of discolored stools and investigate potential gastrointestinal bleeding. I'll schedule some laboratory tests, including for diabetes and cholesterol, since you've experienced recent weight gain. We'll also review all your medications, including omeprazole, and discuss new prescriptions as needed. Lastly, it's important that we schedule regular follow-ups to monitor your chronic conditions and adjust our treatment plan based on your response to these changes.
Thank you, Doctor. It sounds like a comprehensive plan, and I'm hopeful that these adjustments will help me feel better. I appreciate your help.
You're welcome. It's important to address all these issues to improve your quality of life. We'll work together on this. I'll make sure our nursing team schedules your follow-up appointments and helps coordinate the new treatments. If you have any questions or if there's anything else you need in the meantime, please don't hesitate to contact us.
Will do. Thanks again for your thorough approach and understanding.